Rosie, thank you so much for joining me on the Pregnancy, Birth and Recovery podcast.
Thank you for having me.
So this is our episode number 2, as we were just saying off air. First episode, which was back episode number, looking at it, 56. So a few years ago now, we spoke about birth trauma. Whereas today, we're talking about birth after birth trauma. So thank you for joining me in this really important conversation for women. To start off with, what do you, just so that we've all got sort of the foundational understanding, what counts as a traumatic birth?
Yeah, good question, because I think, there is a word, birth trauma, that is used a lot, and it's very individual in terms of what that actually means. I guess birth trauma can cover both the psychological and the physical. So we can have physical birth injuries, which can be a physical birth trauma, which also affects us emotionally, of course, but also psychologically, birth trauma would be any birth experience that is really difficult, overwhelming, or out of control, and has a lasting impact on you as a parent after that experience, as you go into that postnatal period as well.
And when you say lasting, is it defined as a certain period of time?
Oh, not necessarily. I mean, when we think in terms of trauma, we're just, the word is really just used to say that has impacted you and it's kind of stayed with you. So, I mean, obviously, if we're thinking more around PTSD and post-traumatic stress disorder, and any kind of mental health sort of diagnosis of the impact that a birth can have, we would look more at like high lengths of time that those symptoms have been going on. But really, I think there's so many different ways that we can be impacted by a difficult birth experience. And I would consider, birth trauma is really, if a woman feels that her birth has been traumatic, then it's traumatic.
Yeah.
I think
Yeah, okay. And it's quite interesting because before every single podcast interview, I do a Google search of the topic to see what are the common questions that are being asked. I often put it out to my audience. But with Google, all the birth trauma topics in the top page were relating to the birth trauma relating to the baby.
I've seen that.
Interestingly, so it wasn't relating to the mother, and that's what we're talking about today.
Absolutely. Yeah. So sometimes I'm so in this world that I forget that, right? Like that there's this other stuff happening. But I did that recently too. And I saw that there's more posts there. And that's not something which has really come up, though it doesn't come up very often, around what was the impact of the birth experience on the baby. Is that what you mean?
Yeah. Yeah, exactly.
Yeah.
And if something happened to the baby. And I don't know if this is because perhaps it's not as recognized as it needs to be, like birth trauma, maternal birth trauma. Yeah, it's really interesting that it's just not in Google search.
Yeah, that's really strange. So, I mean, I think birth trauma has been getting an increasing amount of conversations and attention. Like, we are having the conversation now about the impact of difficult births, which is so important. Historically, I think there was maybe an idea that just birth is awful, is stressful, and is terrible and painful and all the rest. And so if people had a difficult birth experience, it would be minimized by people around them, dismissed maybe if you were left with difficult feelings after your birth. A lot of parents I've worked with have talked about that sense that other people don't really know what to do with it and kind of want you to just move on, or that you should somehow just kind of accept it and move on. And that can be really, really difficult to move forward, because a difficult birth does leave you with a lasting impact, difficult feelings, and affects lots of things afterwards. So I think there's increasing attention. There was just the New South Wales inquiry to birth trauma is a good example, where we are actually having conversations now about how do we make birth better, which is good, but there's a long way to go.
Yeah, no, absolutely. It's gaining much more attention, which is fantastic. Okay, so as we mentioned, we've already talked about birth trauma. So we're going to try to keep the discussion. I know this is going to be hard because they're so related, but we're going to try to keep this discussion around falling pregnant and birth after birth trauma. So when someone falls pregnant for the second time or however many times, and they've already experienced birth trauma, can this be a time when perhaps some feelings resurface and some emotions resurface?
Absolutely. Yeah. So I actually think that this can happen. For some parents, it will happen before they get pregnant again. Actually, a difficult birth experience can be one of the things that hangs around and prevents people from feeling comfortable or ready to have another baby. So after, if people have experienced a traumatic birth, there's actually research to show that they're less likely to have more children, have a fewer number of children, and have longer gaps. So I think this is what I've seen with the families that I've worked with as well, that often it's a lot of thinking and deliberating before a family might decide that the desire to add another child to the family can kind of outweigh the concerns about having to go towards another birth experience. It can be really challenging. Yeah.
And if someone's listening and this is exactly what they're going through at the moment and they're wanting to perhaps fall pregnant in the future, what would you suggest?
Yeah. So, I mean, I think just knowing that it's normal, first of all, to find it difficult. It's not easy to go towards something that's been really traumatic for you. Like naturally in life, we tend to stay away from things that have had that sort of impact and have been traumatic. So there's very few situations where you would find yourself having to kind of voluntarily go towards something like that again. There are a number of different steps that can be helpful. And I think allowing yourself some time to do the psychological and emotional birth prep as well as the physical is, I think, a really important part of it that sometimes gets neglected. I do sometimes see that there, as well as maybe actually there's probably two camps that families can fall into. There's either a lot of thinking about it and a lot of hesitancy about getting pregnant, and sometimes other people will just go, I'm just going to take a deep breath and just like do it and try not to think about birth too much. And then anxiety kind of tends to rise as the birth gets closer. So it can seem kind of far away enough at the beginning. But as we go through those trimesters and the birth gets closer and closer, often that anxiety can really rise. And sometimes that's a point in time where people might go, I kind of really need to prepare myself emotionally to give birth again. So there's a lot of psychological prep, I think, that can be useful, which I can chat about.
Okay, well, let's, because I'm just thinking of another question, but I'm going to remember that because it's not for now. Let's go through that exactly. Some practical. Yeah.
Well, I mean, I think one of the first steps is that often there isn't enough time to process what has happened when you have a difficult birth experience. And as you said before, like when it can come back up again in a subsequent birth, that's a time, that pregnancy, a really good opportunity to start working through what happened last time, making sense of it and processing any trauma that's kind of hanging around. So what that can look like is really just thinking about not just what happened last time, but how that felt. So as you can see, like it's the opposite of that natural avoidance where we might not want to think about it too much. It's difficult to think about things that were traumatic. We usually don't want to, can bring it all back up again. But I think that's a really important step of preparing to give birth again. We want to really have processed any of that trauma memories that are hanging around so they don't get re-triggered next time. Because you're going back into all of the things that can remind you. You've got scans and appointments and vaginal exams, and it can really be quite triggering. So sort of making sure that if there is any sort of trauma that's hanging around, that's addressed. That's important. But also knowing like what happened last time is going to directly inform what you need in birth next time. So this is a key part of the birth planning process, is to go back.
Can you repeat that sentence? What happened last time
is going to impact. So what happened last time is going to impact what you need next time.
Okay. And you're meaning on many different levels there, aren't you?
I really am. Yeah. On many different levels.
My brain is like fizzling. Okay. Well, let's go through let's dig into that a little bit, because I think that's a really important point that you mentioned there. Can you give us some examples?
Yeah, definitely. I mean, there's no one way to give birth, and there's no one right way to give birth. Like when we think about a good birth, if someone can come away from their birth feeling like that was a good experience for me, what that's usually down to is how they experienced it. So what that actually felt like as they were going through that experience in the kind of just before, during, and after the birth. So the mode of birth is far less important than how you are left feeling about it. So if we take that forward into thinking about if you've already had a difficult birth experience, what happened there, and your understanding of why things went wrong or didn't go in the way that you needed, is going to really affect what you're going to need next time for it to be a good experience. So, for example, we know that like one of the big things that people always talk about with a traumatic birth is a sense of control being lost. And that can happen in so many different ways, from sort of sudden medical intervention being needed through to not being involved enough in the decision-making process and being kind of either coerced or forced into interventions that you didn't really want, or just kind of carried along by the process of the birth and not really being given the support to think about what and stick to what you really wanted. So in whatever way that unfolded for you last time, it can provide you with some really useful clues as to how important it's going to be to hold on to that sense of control next time in all kinds of different ways through the birth, as an example.
Yeah, right. And do you counsel women through, because a lot of what I guess conversation must happen with you, or for anyone who a woman might be unpacking their birth story with, is discussing a potential birth plan or map for future births. So you're effectively counseling and helping someone discover their future birth plan. Is that correct?
Yeah. Like if we think about, so one of the things that I do with the people that I work with, is the families that I work with, is a kind of trauma-informed birth planning. I guess is kind of what this is all about. So that's really looking about how you can plan a birth, all the usual stuff that you might put in your birth plan, what you want, what you don't want, what things you're happy to consent to, what things you would not like to happen. If this pathway unfolds, this is what I would like. But planning that from a sense of going, well, I know that I've already had one difficult experience or perhaps multiple difficult birth experiences. So there are often heightened needs for choice and control and consent. We know that after any kind of trauma, those things become like, they're important in birth anyway, but they are so important when it comes to birth after birth trauma. So you're going to have slightly different needs maybe going into this next birth, to help you feel less anxious and safe. And safety is so important in birth. So after a difficult birth, how do you find a way to rebuild a sense of safety? This all needs to come into the birth planning process. So I think for me, I think it is very psychological, very emotional, not just practical.
Yeah. Could you, and you probably won't like doing this because there's probably what I'm about to ask isn't really possible, but could you provide 3 practical examples of how women might, so explaining that again, can you, sorry, Jono, edit that out. Could you provide 3 practical examples where women who are planning a future birth might be able to regain some of that control? And I know it will look different for everyone based on what has their previous birth been and what are their wishes and or goals and all the rest. But what are some examples of like actual, things to consider?
I mean, look, there are so many different examples that we can think of. One example might be thinking about, I mean, I guess the biggest decision that I think anyone makes when it comes to their birth is where you give birth. So this would be probably my main sort of, it's a very practical decision that you can make, but thinking about, where am I going to feel safe? That's something which is very different to everybody. One person might feel that based on their last experience, like I've had some clients I've worked with where they are going to feel much safer planning to give birth in a hospital with a private obstetrician, with all of that medical care firmly around them, because that's going to be what they need to feel safe about ever going into another birth. For somebody else, choosing to stay as far away from hospital as possible might be where they find a place of safety. And that might look like choosing a different model of care. So that's probably the fundamental and a good example of thinking about how you might make a choice that's down to your own sense of safety, is where you're going to feel safe. I also think another example would be communication. So asking for more communication from the people who are looking after you in your birth is a tip that I always share, because if you have had a difficult experience before, to feel safe and comfortable with the twists and turns of birth as it unfolds, if we can be getting lots of communication from the caregiver who's there just saying, look, this is what I'm doing now, this is why I'm doing it, this is what's happening, this is what I'm doing, and it's one way of being really brought into the process, and it's something that's going to help people feel a lot safer in that moment as well.
And is it relatively, so you meant discussing requesting extra appointments?
Mm-hmm.
Is that what you're discussing here?
Sometimes. Yeah. Oh, I was actually meaning like in the birth itself.
Oh, okay.
Yeah, being brought along for the ride. Because one of the things, especially if something gets a bit complicated during the birth, one of the things that we know can help is having more communication about how that's unfolding and what's happening. Because we don't want to feel in birth that like things have slid out of control and they're just happening to you without your real kind of understanding or consent. So sometimes just having also clear communication can be something that can help people feel more kind of secure and stable during that. If something is unfolding in the birth that's complicated.
Yep, that's great. So you discussed 2 really practical tips. Do you have a third for us?
Yeah. I mean, I think the third tip that I share a lot about is finding your strong voice in your birth. So understanding your rights and knowing how to advocate for yourself comfortably, I think is deeply, deeply important after a difficult birth. This is one of the things that can be really important in terms of having a good experience, but also very healing, to have moved through birth feeling like you were able to have that strong voice, speak up about what you want and don't want, ask questions, say no. This is easy. Sometimes for some people, it can feel really difficult. And it's not something that we're usually all that comfortable doing in a medical setting. So I think it can often be something which is hugely important to practice and work on going forward into the next birth after trauma.
And in terms of choosing your care provider, so you mentioned the hospital, but there's also the options of, which midwife or which doctor, like depending on which model of care you choose. Have you found that women giving birth after birth trauma, they might perhaps trial a few different care providers during the course of their pregnancy to see who they gel with and to see who works well with them? Because I think traditionally when you fall pregnant, you sort of get allocated or you choose your one and then that's sort of it.
Yeah.
Any thoughts there?
Well, choice is like, the reality is that not everybody has choices. Like, we can think about this in terms of the provision of care across Australia. There's not always a great amount of choice. But yeah, the sooner in the process that you're able to think about what do I need for this next birth to feel safe and who am I going to want to do this with, that idea of being able to meet with a few different people, get a sense of, are they on the same page as me about this birth? Like, for example, if you're looking for a private midwife or a private obstetrician, or you're meeting with a MGP, like a midwifery group practice, you want to be getting a sense early on, are we on the same page about this birth? Does this person understand the past experience that I've had and how it's affected me? Do I feel like they get it? Do I feel like they have the same kind of goals, or they care about my goals for birth? Like, do they actually care about how I experience this birth? And do they approach birth in this way that I want?
And thinking this through, I can imagine this would be so much easier to articulate to your care provider, whoever it might be, if you've been able to process it yourself. So and that goes back to what we first said, like getting that support you need to be able to process what's happened. Because if you can't process it, then how do you articulate it for future births?
Exactly. Because I think looking back is how we then look forward. So looking back at that last birth and being able to make sense of, yeah, what was it that made that difficult and traumatic for me? If it was a medical situation that unfolded, but otherwise you felt like the care you got was really respectful and you were really involved, then yeah, you're going to need different things in place to help you feel safe. Whereas I think if, we know that a lot of traumatic birth experiences actually come down to like not having great interpersonal care. And then that's a whole different story. And you might have really different decisions that you want to be making about, I need to make sure that I'm birthing with somebody who is very much respecting my needs and my wishes, and I want to take steps to help me stay more in the driving seat. And to be honest, when I work with families, it's always really individual. Like I have some clients who will say, like everything was fine, but I just cannot be induced again. And sometimes by the time we go through, they might even choose to be induced, but if it's their choice, it's a really different birth experience. So you need to understand what are the factors, and that will come clear as you work through your birth story as to what you need next time.
Amazing. And are there any stats or research, or maybe if it's just your expert opinion, is how are second birth experiences after a first birth trauma?
Yeah, that's a really good question. Look, I don't think it's something that gets researched enough, but there was some research in 2019, I think it was, that showed that the confidence, if people can go into a subsequent birth, women are usually going into that, if they haven't had a difficult experience, a subsequent birth can usually be gone into with a bit more confidence. Because if you go through birth once before, you tend to be able to go into that next birth going, I think I kind of I know birth and I know what I want and what I don't want. And what they've found is that if women go into birth with confidence, it enhances their participation in the whole process. So we're a bit less passive. I think sometimes once you're already a parent, once you're already a mum, maybe you go in a little bit stronger, a little bit more like, no, this is my baby and this is my birth. And that kind of positively influences the birth experience. So the work that I do is a lot about how do I rebuild that confidence and that sense of trust if the previous experience didn't leave you with that. We want to actually see how we can support more parents to go into their next birth feeling ready, feeling confident, feeling empowered, trusting themselves to make the right decisions, trusting themselves to be able to navigate the twists and turns. And that makes a difference next time.
Yeah. Oh, I love this because I see a lot of women, like being a pelvic floor physio, that might have had trauma from a physical perspective and pelvic floor concerns. And so often I'm not encouraging, asking them, have you sought help from a psychologist like yourself? Because it's so important, like everything you're just talking about. It's really positive because although it's been a not ideal experience in the past, moving forwards, it sounds like there's so much room for having a positive birth second time round or third time round or whatever it might be.
Yeah, I really think there is. There's not there's birth is not inherently awful. I really don't believe that it is. And I think this is one of the reasons why I do this work. I do so much work with birth trauma and people who've had difficult birth experiences. But I also fundamentally, I think one of the reasons I was drawn to this work is because I don't think it needs to be like that. And we need to there's a lot of things that need to change to make birth better and the way that we do birth better. It shouldn't really be up to individual families to have to navigate through birth after birth trauma and sort of prepare themselves to go through a system that may not be supporting their needs in a trauma-informed way. But we do know that a positive birth after trauma is absolutely possible. And what I see in the families that I work with is that it can actually be extremely healing to come out of a subsequent birth experience actually going, whichever way it unfolds, I did that and I stuck to what I wanted and needed. And that in that experience, I was respected and I felt cared for. And I felt like I was empowered to make the decisions that worked for me. And therefore, I come away from that experience feeling completely different to the first time around. And I see that all the time. It's very possible to have, and that's very healing on a personal level. It can actually go some way to heal some of the distress from the first time, that you get experiences that were missed out on as well,
beautiful.
personally and with your baby.
Yeah. And I guess that has ramifications throughout the whole first few years of your baby's life too, because if you're feeling better, it's just going to have that roll-on effect.
Yeah, and I think this is what people want. This is what mums want when they come and think about preparing for that next birth after birth trauma. A lot of that comes down to how that birth flowed on to that postnatal period with the newborn baby, and how hard that might have been. Often mums say to me, I don't want to feel like I felt back then. I've got a toddler now, I've got older children. I cannot go back to having another baby and dealing with all of that distress that came off the back of that birth. So I need to be in a better place. I want to be in a better place. And knowing that one of the things that's going to make it that is if you can prepare for birth again and have a better experience and do all you can to minimize birth trauma, then I think there's a sense that you can have that postnatal experience that perhaps was missed out on the first time around.
Yeah, beautiful.
It doesn't have to be that way.
Yeah. And before we wrap up, are there any final, I guess, if someone is listening to this today and, as I said, they're either pregnant or wanting to become pregnant, are there any final tips or piece of advice that you want to provide?
Yeah, I guess what I would say is that think about what a good birth means for you. And also remember what a positive birth generally looks like for, what we do know about a good birth is it's less around exactly how that happens. And it's much more around feeling emotionally supported, respected as a person, is having that sense of control and involved in the decision making. So sometimes focusing on those factors and focusing on that sense of safety can actually give you a lot of good ideas as to how you can actually get what you need from the birth, without getting caught up into so much trying to control exactly what happens, which we can't, right? Which is partly why it's so scary.
Yeah.
But there are definitely things that you can focus on that you can control and that will help you feel a lot safer in birth.
Yeah. Amazing. Rosie, how can anyone listening today, if they want to come and find you, how can they find you?
Yeah, well, you can find me at the Birth Healing Collective, which is the organisation that I've set up for parents and probably specifically mums after a difficult birth experience. And I have a couple of different programs that I run there. One is around exactly this, like how to prepare for your next birth after a previously difficult experience. And I also have a group program which is around going back and reflecting on your last birth. So if that feels like something, you can kindly add the Birth Healing Collective.
Fantastic. And I'll leave all those links in the show notes. Thank you, Rosie. Thank you, Rosie. I appreciate the chat today and appreciate you coming on the podcast.
You're welcome. Thank you so much for having me. It's been great to chat about this.
Okay. See you soon.
Thank you.
Thanks for listening to the Fitness Mama podcast, brought to you by the Fitness Mama freebies found at www.fitnessmama.com/free. So please take a few seconds to leave a review, subscribe so you don't miss an episode, and be sure to take a screenshot of this podcast, upload it to your social media, and tag me at Fitness Mama so I can give you a shout out too. Until next time, remember, an active pregnancy, confident childbirth, and strong postnatal recovery is something that you deserve. Remember our disclaimer, materials and contents in this podcast are intended as general information only and shouldn't substitute any medical advice, diagnosis or treatment. I'll see you soon.